I'm always amazed what NFL players will do to stay on the field. In this case, it's the use of ozone therapy. Dr. Jain has worked with the Baltimore Ravens, the Seattle Seahawks. He works with about 20 players of the Atlanta Falcons for the upcoming Super Bowl. He takes us through a demonstration on what this is and how it works.
We're going to do some ozone injection therapy, and basically what that means is, like, when you have that injured calf, number one, it makes a difference whether it's a contact or non-contact injury. Say we have this calf injury, what we're going to do is we're going to do a setting of around 21 micrograms. So I'm going to set the dial to 9 and 1. Very simple, just turn the dial to 9, and then we're going to set the flow rate on the oxygen tank to 1, and basically we're just going to fill the syringe up. And you'll see here that the syringe is now filled with the gas. Disconnect that.
It's that quick. Wow.
That quick.
And this always based on getting players back on the field as fast as possible. That's really the goal when you're talking about a lot of these guys that want to play in a Super Bowl, that want to get right back. They don't want to lose their position. They're really looking to get back on the field ASAP.
Absolutely. And that's a thing that, time and time again that you run into, is because a lot of times, especially like, earlier in the season or in games where you still have some time to really get right, taking some of these more traditional forms of therapies like the anti-inflammatories or the cortisone, I can understand when there's something that's coming up right away, but if you have a little bit of time, that's really the opposite way you should be treating. Because after you get injured, your body goes through an inflammatory process, and that inflammatory process helps to heal. And so by suppressing that, you help from a pain perspective, but you decrease the body's response at healing, properly healing the area. So what the ozone does, in contrast to like cortisone, is not only is it decreasing inflammation, but it's oxygenating the area. So when you oxygenate the area, you're driving that flow, you're bringing in the nutrients that can help heal that damaged tissue.
I offer up my calf muscle for Dr. Jain's demonstration.
It's a treatment that can be utilized in a lot of different types of disease states. It works very well when we're talking about the professional athlete, because not only can we do this treatment intravenously to help detoxify the body and oxygenate their tissues, we can actually also administer that locally into areas where there's pain. I do various treatments using the ozone for preventative purposes, going into acupuncture points, into key trigger points, especially around the hips. Most people, not just professional athletes, have hip dysfunction, which causes a lot of low back pain, causes a lot of knee and ankle pain, and so we can hit key points in that area to help really relax the lower and upper extremities to help get their body set right to where you're now preventing as much as possible the non-contact injuries.
Amazing what these players go through, that's for sure. You see a picture of Pat Tillman, because I'm going to tell you this.